Welcome back to the London Free Press Podcast. Thank you so much once again for joining us and for being here. If you are behind on your news, don't forget you can always read about the latest things happening in the city and surrounding areas in the pages of the London Free Press and over at lfpress.com. It's all things COVID once again today. I know a lot of people on Twitter already have been responding with who cares, but it needs to happen because once again, there's a bit of a shift happening. And so I'm excited today to be chatting with London Free Press reporter Jennifer Bieman. Jen, how are you?
I'm okay, thanks.
Thank you so much for being here today. You've been all things COVID related in the last week. I've seen several articles published from you. There's a lot to talk about here. So maybe we start with the wastewater data coming out of Western University and the trends that they're seeing. What's been happening?
Right, so we've got a really cool group of people there that have been tracking this stuff, not just in our city, but province-wide. And unfortunately, they're seeing our virus material, COVID virus material in the city really kind of reach levels we haven't seen since March and April. And I don't know if you remember March and April, there was a little bit of a wave there when we kind of eliminated a lot of some of the big public health restrictions. It wasn't like a giant crushing wave, so it kind of might not exist very large in some people's heads, but it was still quite a bit of COVID out there at the time. So I mean, it's kind of unfortunate. I think a lot of people were hoping that we'd have a summer that was largely COVID free, and things could be kind of calm. But we are seeing a bit of disease activity out there, enough that it's certainly worth paying attention to. Maybe not panicking, but certainly like knowing that it's out there.
I had read earlier today that the seventh wave, which we are currently in for those of us who have lost track, is going to peak by next week. And I know data is still kind of limited because testing has been limited. What are we seeing with regards to hospitalizations and the numbers in that regard?
So hospitalizations and deaths are kind of lagging indicators. So they'll come after a peak generally in cases, which is never great, but certainly, that's kind of just what we've seen. For hospitalizations right now, they seem pretty stable. I kind of check the LHSC every day to see where they're at. They're kind of hovering in the teens, sort of 14 to 19 lately, which has been good. Not a lot in ICU. So, it's the one good thing about these waves, and like you're so right, it's really easy to lose track. I have to count them myself sometimes. We're not really seeing the terrible disease outcomes we saw earlier in the pandemic when we were flying critically ill people into London from Toronto, just because hospital capacity was so strained. So, I mean, it'll be important to see how things kind of shake out in the next couple of weeks as far as cases and deaths and hospitalizations go. But I mean, so far it's been kind of calm, at least.
I don't think that this wave really should have come as a surprise to anyone with the lifting of all restrictions, essentially, mask mandates being dropped. And I know everything that I've seen over the last several months has been brace for the fall, kids going back to school. And as we know, more people congregate inside as the weather gets colder. And I think that's why this wave, when you hear about some of the numbers, you think, but wait a second, I know a lot of people are outside. Sunfest that happened this past weekend was packed. I was out there on Saturday and it was wall to wall. It was jammed. With regards to the fall, do we expect to see the numbers even higher than they are? Because I know a lot of COVID deniers will say right now the numbers are not that bad. They're not that bad, but they actually are quite high if you get into the breakdown.
Sure, certainly. I mean, the fall was kind of the thing that we were all looking at for months now, is just sort of looking ahead to waning immunity on vaccines and just kind of that thing. It's kind of anyone's guess what'll happen. We have new variants and subvariants that are emerging, but we also have a lot of cool things in our corner right now. Booster doses are coming out. Fourth doses are now open for anybody 18 and older starting tomorrow on Thursday. So, we've got antiviral medication that's being prescribed at our assessment center. We've got quite a bit of immunity in the population too. The Omicron wave really swept through, really, got a lot of people and kind of built natural immunity in parts of the population. Subvariants can kind of change that calculation, but it's kind of difficult. We've been sort of muddling our way through this, and just when we think we know COVID, it changes things up, and shifts things around. So I guess we'll have to see through the fall, but certainly boosters and the potential of maybe an Omicron specific booster in the future is good news.
You know me, and I love to play the guessing game. Nobody has a crystal ball, but with regards to boosters, Ontario's top doctor, Dr. Kieran Moore, had said the delay in the fourth shot, second booster, was because a lot of Ontarians didn't get their initial booster, so the third shot. What were the numbers like there? Because I don't remember. And what do you anticipate that we'll see with regards to the fourth with the general population under 60 now?
Right. So that's the big news out today. And you're totally right. Booster uptake here wasn't that great. I think it was, 57% of people 12 and older in London, Middlesex getting that shot. Good news about that is a lot of people in that kind of more vulnerable, older senior population have the third and fourth doses. So those rates are highest in the population that probably can benefit the most, or at least at a higher risk of severe disease. It's going to be interesting to see how fourth doses shake out here. I really can't imagine a massive rush on Thursday to book these things. I feel like people have kind of tuned out a little. They've gotten their first and second shot, maybe their third. They're living their life. They're going to Sunfest. They're, hanging out with friends. And so it'll be interesting to see initially how many people come forward to really take advantage of that. How many people kind of hold back, maybe wait some months or wait closer till the fall. And it'll be interesting also to see how the province and health units kind of really try to sell people on these, to sort of market them to people, to say, hey, like, this is why it's important. Here's what you should consider. Here's why you should get them.
I'm glad that you mentioned people holding off until the fall, because I had read something on Twitter, and I don't know how much validity there is to this and the timeline, if it'll line up. But some people were saying, do I bother getting the fourth shot? Because there have been rumors about a new vaccine that will specifically target different variants and COVID on a wider scale. So do I hold off on the booster and then wait for this new vaccine? Have you heard anything about this potential new vax and a timeline for it?
Certainly haven't, but there's definitely a possibility of that kind of Omicron specific or pan kind of COVID type vaccine in the fall. But it's still in development. We never know how these things are going to shake out. It is a big question for people, certainly, and not everyone, I think, will line up for a fourth dose. I think people will hold back, certainly. There's some people that probably need it more than others too. I think that's another part of kind of this phase of the pandemic we're entering, where instead of just kind of blanket edicts, we're trying to kind of tailor things to people more. There might be people that would benefit from a fourth dose quite a bit, and they should really make that a priority. But we're in kind of a weird phase, and I think it's difficult for people to kind of navigate.
I know some people in my life have been saying, well, where is the line with the vaccine? Like, we know the flu shot happens once a year and it's tailor-made off the strain from the previous year. This could potentially be the fourth, or I know some people who have already had their fourth shot in such a compressed amount of time. Do you think we will eventually move towards a once a year shot, or is it still just too early to play that guessing game?
It is certainly a guessing game, but there's sort of thoughts that it can be seasonal. There's thoughts of maybe a kind of a pan coronavirus type vaccine, which would be great. Got a lot of good minds in the world working on this. It's only like the hottest public health topic in the world right now. So, it'll be really interesting to see how this shakes out. The one thing we do know is COVID's here. It's here with us. It exists. It's something that we're going to have to live with or deal with or be aware of, at least. It doesn't have to be something that's at the top of our heads all the time, that covers, that clouds our judgment and makes us just feel really attacked all the time. But certainly, like, it's here, and it's something that we're going to have to deal with, and kind of like seasonal flu or other things, and manage the best we can.
You put that very eloquently, and I hope that people listening take that to heart, that it is here, and it's in my belief, it's not going anywhere. But people still need to be out living their lives safely. With regards to the vaccine and kids going back to school in the fall, I haven't really heard much about young kids having the vax available to them. Has there been any update or progress made on that?
Haven't really heard much since that election, right? The provincial election didn't mention a heck of a lot about vaccines. I know the Liberals had promised to make them mandatory, which was kind of an interesting political stance to take, because, uptake among little kids is good, but certainly not anywhere near the levels that the general population has. So It'll be interesting to see how they handle it in schools this year. But the kind of the tail end of this year for students was pretty normal. Things were good. They were back to normal, generally speaking, and they got to graduate and do proms and graduations and things. So, I don't know what this kind of transition phase of school will look like, how they'll get vaccines to kids, if there'll be a push to sort of make them mandatory. I can only imagine that some people will really start speaking up in the fall about that again. But, right now I think we're kind of all just trying to enjoy our summer the best we can and kind of ride out this seventh wave.
Absolutely. Just looking ahead quickly to the fall again, do you think we will see any kind of restrictions get re-implemented? Jane Sims said to me a while ago when the mask mandate was being lifted, you can't put the genie back in the bottle. And I think she really hit the nail on the head with that one. Because I don't know how we regress, even if it might be needed.
That's a good point. Certainly, I was speaking to one expert at Western this week, and he said, listen, I don't think we're ever going to see kind of those big blanket, heavily restrictive lockdown type measures again, just because that would be very difficult, and there would not be any or a lot of public support for that. So masks, I think, are an interesting one because they're a relatively easy, low risk mitigation strategy that public health has really been trying to promote. There was really good compliance with it when they were mandatory. Now it's really not that great compliance at all. I don't know what they'll do. It's certainly a lever public health can pull when things are getting rough. So I guess we'll see. Yeah, I don't know at what level or threshold that we would see that, but I guess it's kind of brutal being kind of looking ahead with a bit of uncertainty here. But that's kind of the story of the last 2 years.
Absolutely. If people are looking to book their boosters tomorrow, Thursday, where can they do it? Because a lot of our mass vax clinics have closed in the city. So how can people book?
So there's pharmacies and things that you can always go to, or you can go to covidvaccinelm.ca. It's the health unit's website that they've been doing that for a little while on, and they've got, Caradoc still open, and so is the Agriplex, and they've got mobile clinics as well. So, I mean, if you want your fourth dose, it's out there for you, and probably won't have that hard of a time finding it, which is excellent because I don't know if you remember, but not that long ago, these things were like liquid gold. So it's kind of awesome to think back to where we were 2 years ago when we had none of these things, and now they're just kind of everywhere.
Yeah, we were referencing it as the Hunger Games. I do remember very clearly. It was chaos, for lack of a better word. Jen, I just want to say thank you so much for your time today. I really appreciate it and all of your hard work. And I guess we will just wait and see. No one has a crystal ball, but not to wish summer away, but man, it's blowing by. So fall will be here before we know it.
Certainly. Thanks so much for having me.
Thanks, Jen. Okay, so I just want to address something really quickly before we sign off. If you're still here with us, this is my last episode of the London Free Press podcast. I really want to thank you sincerely for your time and being here. And I want to thank all of the Free Press staff. Everybody has been so kind and so wonderful. The Free Press podcast is going to take a bit of a hiatus, just a few weeks, but I promise you I am leaving you in good hands. It will be back, so please stay tuned. And until it comes back, please take care of each other and stay well.